Hello, I'm Dr. Gerald Chodak. Coronary artery disease, or CAD, is the most common type of heart disease. Simply put, CAD is a buildup of fatty deposits in the blood vessels that feed the heart. If left untreated, these deposits can inhibit the heart's blood supply, which over time can weaken the heart and eventually trigger a heart attack. The heart is one of the hardest working organs in the human body. Roughly the size of a fist, the heart pumps over 2,000 gallons of blood every day, supplying the body with the oxygen it needs to function. But just like any other organ in the body, the heart needs a blood supply of its own to survive. The vessels that bring that blood to the heart are known as the coronary arteries. Like all blood vessels, the interior walls of the coronary arteries are smooth, allowing blood to flow easily. Over time, however, these arteries can become clogged due to a condition known as atherosclerosis. This occurs when fatty deposits develop in the walls of the arteries, causing them to narrow and harden, decreasing the amount of blood the heart receives. Atherosclerosis begins in childhood and worsens with age. Scientists believe it starts with an injury to the endothelium, or the innermost layer of the artery. Many factors can contribute to damage of the endothelium, including high blood pressure, high cholesterol, smoking, and diabetes. This damage can result in tearing or stretching of the artery walls. When this occurs, microscopic scar tissue forms along the walls. Over time, cholesterol, calcium, and fatty deposits can become trapped in these damaged areas. This material is known as plaque. Once plaque begins to form, it will continue to grow, narrowing the interior of the arteries and inhibiting blood flow. When atherosclerosis strikes the arteries feeding the heart, this is what's known as coronary artery disease. The body's natural reaction to an atherosclerotic obstruction is to protect the artery by calcifying or forming a hardened shell. But cholesterol and other materials can still penetrate the shell, causing further plaque buildup. While plaque buildup is a gradual process, a far more sudden and dangerous scenario occurs when the plaque shell cracks and ruptures. Doctors are unsure why this takes place, but when it does, it exposes the fatty core to the bloodstream, creating a potentially critical situation. Blood cells known as platelets coagulate or clump together at the injury site to try to repair the artery. Within a few hours, this clumping can form a blood clot, or thrombus, which can completely cut off blood flow to the heart, resulting in a myocardial infarction, or a heart attack. If blood flow is not restored quickly, the heart muscle will begin to die and be replaced by scar tissue. If too much scar tissue forms, the heart is no longer able to pump enough blood to the body. This is what's known as heart failure. Fortunately, long before a heart attack occurs, most people experience the main symptom of coronary artery disease, which is angina or chest pain. Angina is often described as pressure, squeezing, or burning in the chest. Other symptoms include shortness of breath, dizziness, palpitations, and sweating. In most cases, angina occurs long before a heart attack. Nevertheless, if you are having these symptoms, go straight to an emergency room and get yourself checked out immediately. While coronary artery disease can be a very dangerous condition, it is important to know that a variety of treatment options is available, including lifestyle changes, drug therapy, and surgery. And doctors stress that patients with CAD have the best chance of recovery if the disease is identified before it results in something as serious as a heart attack.